because it was something I wanted to help my family out with. You're always looking, okay, well, what else can I do? And then I happened to just see another doctor that was presenting some cases, and I was blown away at the before and after photos. And I was like, oh my God, like I need to learn this. So I reached out to her, and she was like, well, here are some people that I recommend. But Dr. Wong, Simon Wong, is someone that I highly recommend doing the
Mm.
course with. So that was the first light bulb. I was like, okay, well, let me look at this. Okay, he's way out in Australia. How am I going to do this now? And then once I started learning more about the kind of the online program you guys do and how you guys structure it, taking that
Mm.
first course, and then again just being like, wow, this is actually geared towards children. This is exactly what I was looking for. And again, everything that I looked into when I was looking at my own expansion tied in like very, very similar to what Dr. Wong has been doing with the removable expanders and kind of mimicking more of that natural kind of approach to it. So everything was just like a light bulb of like, wow, this is exactly what I need to learn. This is exactly what I need to be doing. And I mean, it's been a total game changer for not only myself, my patients, my family, learning how to do these techniques. And again, I'm only a year into it, so it's still pretty early. But I mean, just seeing the before and after results are already like, yeah, this is what I need. This is what I'm gonna be doing forever now. Like, because I can see that it's not only impacting my patients, but even the people that are around them are asking them like, oh my God, your child looks differently now. I'm like,
Mm.
oh
Mm.
wow, it's great. It's great. It's like, no, when we simplify things and make things easy to understand, it
Mm.
just makes sense. And that's what like the beauty of what I learned with Dr. Simon and Postural Orthodontics is that we can make things simple, and we can make things very, very effective, and they can
Mm.
work.
All right. Welcome, Dr. Harbir, for joining us on this interview. Would love to hear your feedback. It's been almost a year that you've been with Dr. Wong's Postural Orthodontics program, case supervision program. Love to hear your feedback and also your experiences in general. I mean, I remember touching base with you about over a year ago when you first came across us. It must have been was it an ad or something, but you had done a lot of different programs. You don't have to mention which ones. But how did you get started in this early intervention journey?
Yeah, thanks, Ken. It's been an epic year. I will say that just to start
Wow.
off with. I started because it was a personal journey for me.
Mm.
Learning, well, one, trying to fix myself and learn more about like what was going on with myself first.
Hmm.
But
Hmm.
as I started to kind of unravel how I got to where I am today, you start thinking about your family and like what you can do to help prevent them
Mm.
from kind of cutting in the same way. So for me, that was
Mm.
kind of a more personal journey in that regard with my nieces and my nephews and things like that. And I throughout like just my learning process of how I can learn more about myself, it's taken me to so many different
Mm.
different avenues that I was not expecting. Meeting with like chiropractors and other healthcare providers as well to learn about more about posture, and that's what
Mm.
I've really been kind of dialing in and really honing in on in this last year, especially because of Simon's work. And what he's kind of taught us with posture and how important it is, and then what we've kind of lost in that regard with teaching our kids how to maintain correct posture as well.
Mm. Yeah,
And
and it's sorry. Go ahead.
okay, good.
Yeah, it's interesting how I think you mentioned you're a biological dentist. So, can you explain how is that different from a holistic dentist or any other dentist, right?
Yeah.
So,
I think like holistic dentistry and biologic dentistry kind of ties in very closely together because
Mhm.
we're looking at the whole individual, not just their mouth and teeth and gums and cavities and fillings and doing cleanings. We're looking at, hey, how can we optimize how this individual, how this child is growing and developing. And so, as we kind of look at airway and growth development, realize that no, you don't just turn 35 and all of a sudden develop like sleep apnea. This is something
Mhm.
that's been growing and building for years and years and years. And then you realize that, whoa, there's actually that optimal window of when we can treat these kids and really
Mm.
make dramatic changes in how they're growing and how they're developing. And that's what makes it exciting to be a pediatric dentist and really be on the forefront of what we can do. Because, as I think as anyone that dives into biological or holistic dentistry, it's like we see that there's a bigger picture at play. And we
Mhm.
see that where we fit into this bigger picture of like what can we do to really make that bigger difference that we're trying to achieve. Because again, a lot of this we're not really taught in dental school. But it's stuff that we have to like go and seek and learn as we start to learn more about this small subject, we're like, whoa, there's this whole other avenue of dentistry that we didn't know existed before. And that
Mhm.
just makes you want to dive deeper and deeper. And again, like the learning process never ends. Like I'm still taking courses and spending weekends with you guys, like learning more and more about airway breathing, but also
Mhm.
of
Mhm.
development and again holistic and biological dentistry at the same time. So
Interesting.
exciting.
So, were you trained as a general dentist or pediatric dentist, and then kind of got into more biological aspects?
Yeah, I think again, for myself is this like, okay, how do I, I think when we're young and we're invincible, like we don't
Mhm.
really take too much care in our health. But then when something happens, or a family member or a friend, something happens to them, then you start thinking a little bit differently. For me, it was my neck and my back, and
Mm.
I started having numbness in these two fingers. And for any dentist, as soon as you get numbness and tingling, you're like, oh my god, this is my career is over. And so that
Wow.
happened several years ago, and I was like, "What?" I'm like, "I'm so young. How is this happening to me?" And then I started looking at healthcare differently, where Western medicine was more like, "Okay, let's do a shot or a fusion surgery," and I'm like, "Whoa, like let's look at other options here." And I think that's the same way when it came to my mouth and like my expansion journey. It was like, okay, yeah, you can do like surgery to split your maxilla open and do this,
Mm.
or you can look at more conservative options. And I'm like, well, let's try the more conservative option first. And if that doesn't work, then maybe we can take some other measures. But a lot of it is just again, getting the sleep studies done, doing the myofunctional therapy,
Mm, mm, mm,
doing all the foundational stuff. That again, once you do that, and you realize, whoa, I did all the things I was supposed to do, and I'm still finding some restrictions. Okay, maybe we jump into a lip and the tongue tie and get that procedure done. And
mm,
again, even with that, it was like I was only planning on doing my tongue. And then when I saw the cranial psychotherapist, they were like, wow, you have a lot of tension in your face. You should probably think about doing your lip too. And I was like, what? Like, no, my tongue is what's restricted, not my lip. And then once she talked me into doing the lip tie, I was like, all right, let's just do it. And then the first thing I did is I took a deep breath through my nose and I was like, whoa, like this is,
wow.
I can breathe easy through my nose now too. So
No, it's really interesting how, it's been a personal journey for you. And, now knowing what you know now, right, going through hundreds, hours of extra training, postgraduate, graduation in your field, if you could have a time machine and go back and advise your parents, my brother's Dr. Simon Wong, just to clarify those who are not so familiar, I'm helping with obviously the business marketing side of things. And I'm a parent. I've got a 6 and a 7-year-old, and this is all a new journey for me. I mean, I started helping my brother 6, 7 years ago, roughly as well. So it's been a really interesting, educational, eye-opening journey. I had a lot of crooked, weird teeth as well, and glad I didn't pull out too many. But tell me, what would you advise? What would you have advised your parents? Knowing that you've gone through your struggles, well, what would be some of the epiphanies that you've had that you wish your parents knew about this, and it would have perhaps prevented some of the traumas that you've had to go through.
sure. I mean, luckily, being first generation, my parents had a very traditional diet
Mhm.
before moving to this country where,
Uh-huh.
and I think even because of that, like, we know every successive generation is going to have more evidence of malocclusion because of the epigenetic
Mm,
changes that occur over time. And so I'm grateful that I have not had a lot of those diminishing kind of returns on my facial growth development. I had minimal,
mm.
which is why I didn't really need much orthodontics at all or
Oh,
braces
good.
at all. But again, even from that standpoint, what got me into this was that my bite was actually edge to edge. So I was literally hitting teeth like edge to edge on my teeth. So I was
Mm,
grinding away my teeth, and dental school is when I first noticed this. And so that was the thing that I was like, whoa, like what I do to fix this? And it was again doing the regular orthodontic treatment, which again didn't really just kind of tilted my teeth around. It didn't really fix the main issue, which is that my jaws didn't grow out wider. So again, looking at the diet, like eating harder foods, crunchy,
mhm.
not crunchy foods, harder foods that make you chew a little bit longer. Um, I think that would be the real key to a lot of solving this. I asked my mom about it. It's like, yeah, I was nursing, so she was doing that front. I don't
Mhm.
know how long she was nursing with me, but I definitely feel like a lot of that played a big part in this as well. Um, and then,
Now,
I think
could they have done any expansion work, or was
no, I
that
mean,
wouldn't
my
have
teeth were,
arisen?
I didn't really have much crowding, thankfully.
Oh, okay.
So
Good, good. I mean, you look like you have a great set of teeth. So you didn't pull out, didn't extract,
no extractions, no pulling out
or,
any.
you're one of the more fortunate ones, obviously,
Yeah,
but
one
yeah.
of the more fortunate ones. I mean, I had to get my wisdom teeth, and that's because essentially they did cause a little bit of pain and discomfort.
Mm-hmm.
when I was in dental school, like around 23 years of age, I think.
Mm-hmm. Mm-hmm.
So that was the first step of like, okay, well, getting those removed and taken out because I
Sure.
didn't have enough room. But yeah, at some point something happened, and I'm assuming it was probably when I moved to boarding school,
Uh-huh.
because that was probably a pretty trying time in my life, and so I think sympathetic nervous system and things were activating, and so I think at some point I started mouth breathing around that time.
Ah,
That might have changed how the direction of my facial growth started to
yep. Yep.
change. Um,
So,
that's what I can assume.
so back to, the whole mouth breathing, the posture, you've done many different courses. How is Simon's course, I guess, different, and the mentoring? What have been some of the benefits of being part of this kind of cohort, this mentoring program?
Yeah, most of the other courses that I've taken, I felt were more geared towards adults and correcting OSA and
Mhm,
sleep apnea. But again, as a pediatric dentist, you're like, okay, well, what can I do for these kids? And so I looked at some different appliances and things like that that you can put in your mouth to retrain your tongue. And I realized that they do work, but you have to be really on top of those to really see the gains. And unfortunately, just most people just aren't ready to put in the amount of time and effort that those require to get the changes
mhm,
that we're hoping to achieve. And so, you know, again, because it was something I wanted to help my family out with, you're always looking, okay, well, what else can I do? What other options that you are available? And then I happened to just see another doctor that was presenting some cases, and I was blown away at the before and after photos. And I was like, oh my God, like I need to learn this. So I
mm,
reached out to her, and she's like, well, here are some people that I recommend. But Dr. Wong, Simon Wong, is someone that I highly recommend doing
mm,
course with. And so that was the first light bulb. I was like, okay, well, let me look at this. Okay, he's way out in Australia. How am I going to do this now? And then once I started learning more about the kind of the online program you guys do and how you guys structure it, taking
mm,
that first course and then again just being like, wow, this is actually geared towards children. This is exactly what I was looking for. And again, everything that I looked at into when I was looking at my own expansion tied in like very, very similar to what Dr. Wong has been doing with the removable expanders and kind of mimicking more of that natural kind of approach to it. So everything was just like a light bulb of like, wow, this is exactly what I need to learn. This is exactly
mm,
what I need to be doing. And I mean, it's been a total game changer for not only myself, my patients, my family, learning how to do these techniques. And again, I'm only a year into it, so it's still pretty early. But I mean, just seeing the before and after results are already in my like, yeah, this is what I need. This is what I'm gonna be doing forever now. Like, because
mhm.
I can see that it's not only impacting my patients, but even the people that are around them are asking them like, oh my God, your child looks differently now. I'm like,
Mm,
oh
mm.
wow, it's great. It's great to see.
Yeah, there's a lot of pediatric dentists my very interested in this program, and general dentists interested in this area as well. But how, I guess, if a lot of people don't have a lot of orthodontic experience or training, is this, how would you advise them? A lot of people, would they be worried about, oh, I haven't done a progressive 1 or 2 year course? Is this something that you find, was it difficult to implement these removable appliances, the upper, the lower?
Yeah, I wouldn't say it was difficult. I think a lot of it is just was my own kind of fear of like, oh my God, like how do I do this when I don't have someone teaching me the intricacies of the wire bending. But again,
Hmm.
when you go back to the different lectures, and then again now you're doing the one-on-one with Simon and getting like to just go over cases with him and learn directly. It helps
Hmm.
just build your confidence because you have someone that's like mentoring you
Mm,
through the process. And I think that's the big key is like every patient is going to have something slightly different that you have to kind of
mm,
be
mm,
aware of and work with. So then that's what's great about what we're doing here is that we get that opportunity to work with Simon, go over
mhm,
cases, and you really have someone that's just there watching your back and making sure you're doing everything correctly. And so I think that's
yeah,
what really kind of helps. And luckily I did have a little bit of orthodontic education in residency, so that obviously helped a little bit. But I haven't done removable appliances like um, for like elderly patients since dental school. But then when I was doing mine, I was doing a little bit of wire bending for my own
yeah,
case,
yeah.
and then that kind of helped a little bit. But it's always a little bit nerve wracking just making sure you're doing things correctly. But luckily, nothing was too daunting of a task. Nothing
Mhm.
has been too too unmanageable. It's
Sure,
been really
sure.
good so far.
I mean, by definition, dentists are good with their hands. They wouldn't get into the profession otherwise. And it's interesting how, watching as a layperson, seeing, the designs, they're all custom built, right? They're all custom built around that child's um structure, and you're clasping certain teeth, making sure that the teeth aren't going to be falling off at the wrong times. And the window of opportunity, as a parent listening in perhaps to this interview here, what is this golden window that we're talking about? And traditionally most parents think, oh, they might send them to an orthodontist at 6 or 7, or others would say, oh, just come back when the baby teeth are gone at 12 or whatever. How is this, summarize this in a nutshell for the layperson, or even for a dentist thinking of wanting to get into this field? What are the protocols? If there were 3 pillars, let's say, as a summary, what is postural orthodontics?
Well, I mean, I think it starts like early, like even before they have teeth.
Mhm.
Whether that's starting with the nursing, and again, we take the babies right from the hospital. We're putting them in carriages or in car seats that again keep them tucked in and keep them in poor posture, right? So I think a lot of it is just being aware about a lot of the traumas that we're creating for our children, and just kind of being like, well, what can we do to actually support them in a more beneficial way? So ideally, yeah, you are able to nurse for 6 months, 12 months, year, 2 years, as long as you're able to,
Mhm.
because again, not only is breast milk very nutritious, but again, it also helps build the
Develop the
musculature,
jaws,
helps the
muscles. Yeah,
jaws,
people don't
exactly.
realize that
So it's like
suckling
that's like
motion.
beginning stages of it. And then look at like a lot of our diet and like what are the foods that we're giving our children? These crunchy processed foods, which are very inflammatory, which then can affect the airway, the breathing, the tonsils, the adenoids, all the structures that are necessary for good oral function habits and posture. So again, when we kind of look at all that stuff, it's really challenging in this day and age to do things correctly, because again, a lot of the things that are out there are teaching us easy ways of doing things, not actually what's actually best for us. And so I
Mm,
think the first step is just being aware about that, and being educated properly, which unfortunately sources for education and proper education are very few and far in between.
mm,
But that's, I think, the biggest step is just being aware that there's a lot of things that we're doing that are not correct, right? And even kids that nowadays eating at the dinner table, it's like we're scarfing down food. We're in a hurry to get from one thing to another, one practice to another activity, and so we're not spending the time to sit to get down at the dinner table, eat our meals with good posture, mouth closed, doing things like that. So I think it's a progression over time
mhm.
that is leading to underdeveloped jaws over time, and it just unfortunately gets worse and worse. Just like any muscle going in the gym, I
Yeah,
gotta I
yeah,
gotta keep working up that muscle and keep working at it. Otherwise, I'm going to lose the gains that I'm potentially could be gaining
yeah,
over
yeah,
time as well. Um, I think that's the biggest key here is it's a
yeah.
process, and it's not just a simple appliance that you just put in. It's a lot of work and effort that has to go into, especially when we look at posture orthodontics. Anyone can do expansion, but what are we doing to recondition the posture, recondition the tongue, the lips, the cheeks to actually
Mm,
work and function as we should be functioning in an ideal situation? And that again takes effort and takes time, and I think a lot of that is very challenging
mm.
for any of us in this day and age.
Yeah, so a lot of parents, they don't start noticing their child's teeth. There's crowding around that 6, 7, 8.
Yeah.
They've, let's say, done the wrong. They didn't realize, the importance of, making sure the child's keeping their mouth closed and chewing properly, and everything else. In the ideal world, in this crazy busy world that both parents are working and whatnot, so they get to you at 7 or 8. What is then postural orthodontics, right? So I get it. Someone explained to me, Simon, look, we're expanding when there's crowding, right? When the teeth are coming out, there's not enough room. There's a way to actually expand the arches, right? The upper. A lot of people doing, the maxilla, the expansion of the upper, but not a lot of people do the bottom expansion. And why is that? And what has Simon taught you to give you that? Wow, it's possible to expand the lower properly. And then the missing piece is the importance of what Simons and Dr. Sandra Khan co-wrote, GOPEX, Good Oral Posture Exercises. Just kind of finish off by explaining the importance of why expanding the lower, how it's done properly, and also, the exercises and how that ties in.
Yeah, I think Simon's really done a great job of really imparting on me that window of like ideal growth development, and then again hitting that mandible at the right time. Like 7, 8, 9 years of age when we get
Mhm.
that little bit of that growth for the mandible. But again, with these removable appliances, what we're basically doing is we're creating more of a mimicking effect of nature, where we're getting forces that are kind of active
Hmm.
and not active, active, not active, active, not active. And so, when we're growing the bone, that's the type of force that actually helps the bone develop the most and remodel as well. And so what we're doing is we're helping the bone to kind of remodel a little bit as
Mm.
we kind of expand and cause the jaw to grow into a more ideal position. So it's like we're not
Mm-hmm.
really technically expanding, but we're kind of reconditioning the bone to grow at a rate where we can kind of remodel it a little bit. It
Mm-hmm.
may not like fully get the expansion that we're hoping to achieve with the bottom, but at least we're remodeling and gaining more width with the jaw that we wouldn't normally otherwise be able to achieve with just a constant crushing force against the bone. So that's why I really like gravitate towards this because it was everything that I was learning with my own growth development as well and my own expansion for myself is that you don't want these constant crushing forces. You want intermittent forces because that's how bone remodels over time with a little bit of pressure, release, pressure, release, pressure, release. Just like our tongue. Our tongue hits our palate, it lets
Yep.
go.
Yep.
We swallow it, let's go. Swallow, let's go. So we're kind of mimicking that same natural force, and that's how we help to remodel the jaws in a way.
So
But again,
there's that window when it's relatively soft, right? It's growing, the mandible, 7, 8, 9, but the bone is not rocket hard when they hit 10, 11, 12. They're getting, more
more dense.
rigid. So it's a lot harder to remodel and get that extra width.
Yeah,
Is that the basic understanding of it?
yeah, yeah, and again, also, like, hitting the jaw while it's in that growth for spurt
Ah.
phase, so that
Mhm.
you're actually, encouraging the jaw to grow a certain direction, dimension to get that
Mhm.
width down and forward, but also a little bit wider at the same time as well.
Then how does GoPex play an important role to tie it all together and
Yeah.
prevent relapses or whatever, right? So how to explain that in simple terms.
Sure, like, I think that's the secret sauce with what Simon's doing is that's the missing link that so many of us care don't really appreciate it enough, is that we're relearning how we want to be in our correct resting posture. And that's, lips together, teeth slightly touching, tongue on the roof of our mouth, breathing through our nose. So that's the real key when it comes to what is correct resting posture. But how do we achieve that, right? I mean, we all can say, okay, keep your mouth closed. But then we don't know if are the teeth actually touching or their mouths apart because there's so many other underlying structures and functions that are again dysfunctional because of inflammation and other things in the body. So it's really kind of honing in onto again simple exercises that we can do, throughout the day that help to kind of reinforce that correct resting posture. So
Mhm.
that's kind of what's the beauty about this is it's not that it takes a lot of time and effort to do this. I mean, yes, it does take effort and does take time.
Sure.
And again, as a dentist, like that's very honed in on this. It's easy for me to say, oh yeah, like it's really easy and simple to add this into our normal routine. But again, this is stuff that as kids we were taught to sit at the dinner table with good
Mhm.
posture, sitting upright, not slouching in front of the TV, eating with our mouth open and just shoveling food down as quickly as possible. We were sitting at the dinner table together as a family, eating our food,
Same. Yeah.
bite by bite, yeah, and really taking time and being present, with our food, with our meals, with action of chewing food, not just scarfing food down as quickly as possible. But the way that Simon kind of has GoPex, right, is it's broken up into different steps to make
Mhm.
it so that
Mhm.
we can work on improving not only our posture, but also how we chew, how we swallow our food, and how we
Mhm.
put ourselves back into that correct resting posture. Because that's the real key is maintaining that resting posture throughout the day, not just when we're eating, not just when we're being aware what our parents or friendly
Mm.
dentist is watching us doing these exercises. We want to maintain that resting posture throughout the day when no one is watching. But
Yeah.
again, that
Yeah.
takes time, takes repetition, it takes practice.
Yeah, yeah. I mean, it's compliance is a term that I was learning about, and it's like it's a headache for a lot of people. Like, there's all these very fancy different exercises out there, myofunctional this and that, and that's great for for a lot of adults are doing these retraining exercises, but for children that 7, 8, 9, you want something simple, right? And that's where GoPex I think plays an important role. It's simple, but it's effective, and and it's free. Like we give it away. We every person in our network of dentists who want to give the ebook away for free. If you're listening in and you're in which part of California are you based?
I'm in Southern California, right in between Orange County and LA, basically. Close to
Nice.
Disneyland.
Nice. There you go. Well, you can reach out to Dr. Harbor. He will give you a free copy of this book, ebook version, and you can check out the 30-day challenge that we have. It's free. So just reach out. What's the best way to get for people to get in touch with you? Elevate
You
Kids Dental.
Yeah, thanks. You can either go to our website, www.elevatekidsdental.com.
I got it.
You're,
I see the nice logo there. So just
yeah,
literally
yeah,
that elevatekidsdental.com, and I guess they can reach out to your team to get a free download or a consultation or whatever. But
yeah,
and any dentist who's thinking of, perhaps joining, if they can, if you don't mind, just if they can send an email to you if they want to get your thoughts, I'm sure you'd be happy to send them some whatever, give some advice. But thank you
yeah.
so much. I know it's dinner time over there, so I'll let you get back to your family. And no, appreciate you being part of our mission, you could say. We're here. It's great work with the work that you're doing in California. Only Simon can only help kids in Melbourne, Australia. I'm in New York, but we're trying to share this with as many dentists and families as possible. So prevention is key, and we can make a difference in as early as possible. So thank you.
Absolutely.
Appreciate you
Yeah.
sharing your experiences.
Oh, you're so welcome. And I think on one final note, like as you were just talking, I was like, oh yeah, you know what makes this so nice is that when you learn about it, it just makes sense.
Mm.
Like
Yes.
we don't have to overcomplicate things. And I think that we tend to do that a lot because it's like, oh, the more complicated it is, the more the bigger the outcome or the better the results. Like, no, when we simplify things and make things easy to understand, it
Mhm.
just makes sense. And that's what like the beauty of what I learned with Dr. Simon and Postural Orthodontics is that we can make things simple and we can make things very, very effective and they can
Mm.
work. We don't have to overcomplicate things, and which is I know we love doing that nowadays. But it's just nice to be able to be like, okay, now I'm at a place right now where I'm learning something that I feel very confident doing, and I know that it's actually the best thing for my patients. Is it the easiest? No, it's not the
Mhm.
easiest option, but it's the best. And again, if I was
Mhm.
looking at for what would I want for my family,
Sure.
this is what I came across, and I was like, oh yeah, this is a no brainer. This is what we're doing, and I'm
Mhm.
so grateful to have found you guys
Thank you.
just been implementing this in my practice for my patients because I know it's not the easiest, but it's the best for them. So it's great.
Absolutely. Well, thank you so much, Dr. Harbor. Take care.
Yeah.
All right.
Thank you.
Cheers.